G'day guys, Dr. James here from VetDojo, just doing a short video for our membership channel today, looking at my problem challenging case for the day. So we have here Pogo, who is a 9-month-old mixed breed dog, and Pogo is our challenge because he has an angular limb issue in his front leg, and what you'll notice is he actually only has one front leg. So when Pogo was younger, he had his other front leg amputated for growth plate related issues, and subsequently he's gone on to develop more growth plate related issues, and he walks with a very pronounced varus in his leg. So if you look down here, we can kind of see this varus angulation that he has. So Pogo, I've been monitoring for a number of months, taking x-rays to make sure he's not getting any incongruence in his elbow develop, and that's been okay. He was doing okay clinically, but in the last kind of 4 weeks or so, the owners report that he's getting much weaker on his leg, and I think he's quite uncomfortable, actually around in his wrist more than his elbow. So we did a CT scan to kind of model the leg and to see exactly what angular changes were going on. And when I did the CT scan, I actually went ahead and printed a 3D model of the leg, which I've got here. And I printed this model because the angular changes are not very straightforward, I believe. They're not related to necessarily just a premature closure of the radial physis with a varus development. They're more related to like a translation or a subluxation of the radiocarpal joint. So we've got radiocarpal bone here and the radius here. So I think the carpus is kind of subluxated to the medial aspect. And there's also a huge amount of rotation, and that's the thing that I'm most interested in and the thing we're going to correct. So if we look at this bone model here, and then we look down the axis of the bone, you guys can see how much rotation there is in the leg. And so when we do his correction today, I'm actually going to put pins in the leg like we have here, kind of rehearse the surgery, and then we're going to actually rotate the leg, get those pins parallel, and I'll take a small wedge out of this distal segment to get those radial segments to sit together nicely. And then once we've done that, we'll have our alignment. I have had a fairly frank discussion with the owners about this subluxation in the carpus. It's not something that's mobile, and I think it's probably developed over time as he's been walking on just his single front leg. But I do think that if we can get rid of some of that rotation and straighten his leg out, that his function will improve. I do have an element of kind of concern in my mind that he may still develop some arthritis and problems in that carpus. But I've warned the owners, if that happens, we always have in our pocket the ability to do a pancarpal arthrodesis. So, bit of an interesting case, bit of a challenging one. Stakes are a little bit higher because he only has one front leg. So we're going to get started with the surgery in a little bit, and I'll keep you posted with how everything goes.